Okay, here we go. So we're talking about acne, active acne, and acne, what we can do. Some of the treatments that we were talking about were some chemical peels and hydrofacials and the acne treatment. And in the Manhattan office, we have something called smoothie that helps to kill acne bacteria on the face. Okay. Oily skin and large pores, they come hand in hand. So if you have large pores, it's usually because you have oily skin. So we have products that help with that. But in-office products, in-office treatments are chemical peels, Fraxel, Clear and Brilliant, and hydrofacial also help clean out the pores and help with the oiliness. Another thing is that we have is a renewal cream that it has a little bit of a retin-A in there, and retin-A actually helps to control some of the oil secretion, um, along with some microexfoliating pads and some triple set pads that you would use. They work in combination together and work a great treatment. Next one will be dehydrated skin. A lot of people have dehydrated skin or dry skin, cracking, itching, dry patches. Um, so you want to exfoliate that skin. You want to take off those top layers. So retinol serum is a good option because it helps to hydrate the skin, and at the same time it helps to take off those top layers, which will stimulate some cell renewal. Moisture drenched, you need something with a hyaluronic acid that's going to help to moisturize but not give too much oil into the skin. A signature eye cream is great for around the eyes for dehydrated skin. It helps prevent those little crepey, those crow's feet. And in office treatments, you're going to see a pattern chemical peel, which we talked about already. Chemical peel is good because it'll help to stimulate some of that cell renewal. Hydrofacial also is good because it'll help to bring some hydration to the skin and exfoliate as well. And another thing is good is a laser genesis. It's like a 1064 laser, and it's like a micro exfoliating treatment with a laser. And it's good for actually many skin conditions. It's good for oily skin. It's good for dehydrated skin, and it's good for redness as well. Good. Aging and preventative. We have many products for aging and preventative and treatment. Our signature cream is good. It helps lighten skin and exfoliate the skin. We have some retinols that we have we have a variety of strengths of retinols that we have, depending on what your needs are. Glow cream works great. Anyway, our in-office treatments for that is chemical peels. You can do some BBL treatments, or otherwise known as IPL treatment. We have Fraxel and Fraxel Clear and Brilliant, and also the laser gem. Good. Pigmentation and melasma is a really, really difficult one, which we treat a lot of in this office. Melasma is one of the more difficult treatments to conditions to treat because it's hormonal. A lot of people, when they have a pregnancy, they get what's called a pregnancy mask, and it's sometimes it's on the upper lip and sometimes it's on the cheek, and it's very difficult to get rid of. You can only try and control it. And pigmentation from sun damage. Sometimes you can get some pigmentation from an acne scar that's left behind. You'll get left behind a little brown spot left behind after the acne has gone away. So, of course, there we go. Chemical peels again is a good option for that. Fraxel, BBL. BBL cannot be used if you have melasma though, because a lot of people will treat melasma with BBL and it'll look good initially, and then what will happen is that a couple of weeks later, the melasma starts to look worse because heat will stimulate the melasma and actually end up making it worse. So we never treat melasma with a BBL. A skin priority is based on age. When you're in your 20s, most of the time you have some acne, some oiliness. In your 30s and 40s, that's when you start to see you want to treat some fine lines and some wrinkles. And then as you get older, you have some loss of elasticity and collagen. Good. Now, women of color, Asian, Hispanic, Middle Eastern, African American, and Indian, they all have special concerns. The skin is very, very sensitive and it pigments very easily. So it's like I said earlier, if you get a pimple and then you squeeze it, or even you don't even have to squeeze it, once the lesion goes away, you'll end up with a brown spot. So you have to be really careful and not be too aggressive with treatments on dark skin types. So Fitzpatrick 4, 5, and 6. You have to be really careful. Okay, so most of the concerns that people come in that a chemical peel can address is it helps improve the texture of your skin, it increases the cell turnover rate of your skin, also helps to produce more collagen. It helps reduce fine lines, hyperpigmentation, helps to leave your skin smooth and clean, and unclogs your pores. It helps to clean up acne as well. Um, I love doing peels because I think it gives you the biggest bang for your buck. I think when you first come in, if you've never had anything done, I think a peel gives somebody, I think, a bigger result in one peel than, let's say, one Fraxel, because you need a series of them. And peels, you'll see a really nice result. If you've never had a peel done, you'll see a really nice result from one time if you choose the right peel. It is like a magic treatment. It cures many things. It helps so many things. Even though some people can sometimes be nervous and say, "Oh my God, a chemical peel is faster on my face," but it just helps to dissolve the top layer of skin, helps to dissolve the intercellular glue that holds that skin down, and then it just tells the top layers off. And it reveals beautiful, smooth, glowing skin underneath. So who's not a good candidate? Of course, if you're pregnant, you can't do anything when you're pregnant, or nursing. And if you've been on Accutane, we can't do anything. We can't do peels, we can't do any kind of laser treatments. So you have to be, I like 8 months to a year. But depending on your dosage, we could possibly start doing things on your skin at 6 months. Also, if you have a history of getting cold sores around your lips, some people, even if they're in the heat, they'll get a breakout on their lips. If you're going to get a chemical peel, we have to pre-treat you with an antiviral. Okay. Also, if you have any other cancer or autoimmune disease, not a good idea to do a peel. Okay. So what is a chemical peel? So a chemical peel is a combination of acids that we apply to the skin that'll help to stimulate some new cells. And there's many different types of peels, but the ones that we deal with here, there's some superficial peels, medium peels, and some deep peels. And it all depends on the combination of acids that we use and how deep we want to do a peel. Okay. Superficial peels and medium peels are very safe and as long as it's done correctly. And some of the deeper peels, most of the time, Dr. Charlie does. Okay. So some of the peels that we have that are over the counter, glycolic acid, lactic acid, scrubs, that you can get over the counter, they give a minimal result, but it's still good to do at home. um, once a week or every other week. It gives you a nice benefit of help with clogged pores and to help to stimulate some collagen. Good. So here's a picture of how deep the peels go. Depending on what we're trying to achieve, we would choose the right peel for you. If you don't want any downtime at all, we'll do a superficial peel. But if you're willing to peel for a few days, we can go a little deeper. And it may not look pretty while you're peeling, but a week or two later, you will love the way your skin. So some of the more superficial peels are like a lactic acid. You don't normally peel from a lactic acid. And then we have the peels that we do in the office that are more medium depth peel. TCA. We usually use a combination of acids that will give us the result that we're looking for. Okay. And here's a chart that shows you what chemicals are in the peels. And when I say chemicals, it's really like a glycolic acid, salicylic acid. These are all things that come from fruit and vegetables. TCA is not, but that's a little stronger of a peel. So you gotta look at the strength of them. If you could tell TCA is in all three of them, but the deeper peels you use a higher percentage of TCA. And they all work well for the right person. So superficial peels, you'll start to peel around the mouth, like day 3 or so, you'll start to peel from around the mouth, and it'll kind of work its way up the mouth. Medium peels go a little bit deeper, and you'll see a little bit more of a peel. So not everybody peels the same way. Some people flake, some people peel, and it really depends on what you're using on a regular basis. If you're using a retin-A on a regular basis, you may not peel that much, which is fine. You're still getting that result. You're still getting the improvement because you're still peeling on a micro level. It'll help with the oil. It'll help with the fine lines and wrinkles. Um, but most people, when they do a peel, you're gonna have skin that just peels off, and then it can last anywhere from 3 to 5 days. So now the deeper peels, you need to be um, you need to be sedated for, and Dr. Tehrani does that. And that's not what we're talking about today, but you do have options. There's many different levels of peels that you can do, and if you really just want to do a one and done, you do a deeper peel, and that's done by Dr. Tehrani. It can also be done with a laser. Okay, what are the risks for a peel? So some of the risks are, as we talked about earlier, cold sores. If you get a cold sore, so if you have the herpes virus, it can actually stimulate an outbreak. So you have to be really careful. We go through a medical history to make sure that won't happen to you. Um, Scarring or infection is very rare, but that sometimes happens if you have a cold sore. You don't notice you're having a cold sore. So that's why we go through a whole medical history before we um, we do a chemical peel. Darkening of the skin or lightening of the skin can be permanent if you're doing a deeper peel. But on deeper peels, we don't do them on people of color, well, because of that reason. Because we don't want to permanently change your skin for the worse. So after a peel, you're going to be a little bit more sensitive. You have to put sunscreen on at least for a month. So what to expect after the peel? So after the peel, your skin is going to feel like tight, and dry. And depending on which peel we choose, sometimes it looks a little brown after a couple of days, like 2 days, and tight, and it feels like you can't put any moisturizer. And what will happen is that the skin will kind of dry up and it will just start to lift and start to turn over. And it will take about 3 days to start. So you don't peel the day of the peel. You don't usually peel the next day. You start usually peeling on day 3. And it starts from around the mouth because it's where we move the most. And it kind of works its way up and out. Okay? There we go. The aftercare of the chemical peel really depends on how deep we're going. But you're just going to put some makeup on. I'm sorry, not makeup. You're going to put some moisturizer on. And some people need a little hydrocortisone because it starts to get itchy and it may burn in some places once it starts peeling. And you just have to put a sunscreen. So how often you should get a chemical peel really depends on what we're trying to treat. If you have active acne, we like to treat them every 2 to 3 weeks until we get your acne under control. And then we put you on a maintenance program. And a maintenance, like for myself, I do it 3 times a year. Sometimes 4, but usually 3 times a year. And it's just good to do as a maintenance. Instead of getting a facial, I usually get a peel. I find that when I put on makeup and you can actually see the makeup on my face, then it's usually time for a peel. So we're offering some VI peel kits to do at home. So we're going to go through a demo later. I'm going to show you how to apply it. In order for us to ship it to you, you have to go through a medical history and we will do it virtually after we ship it to you. So what's included in your peel would be your peel, a little packet. I'm going to show you later after I do the demo. You're going to have a glove. I'm going to give you a little container of Aquaphor, a Q-tip, some alcohol pads, and some gauze. Okay. Good. And that's what's going to start to look like after a few days. It's just going to start to peel, which is what you want. And sometimes what you'll notice is that if you have some underlying acne, it can actually make it purge. So it may look a little worse in the beginning. So you want to just keep that in mind. So it's not going to make you break out more, but if you have some underneath, or if you feel your skin and you feel these bumps underneath, it's going to actually purge. It's going to make it come out. Good. So he's going to go over some before and after pictures. This is a patient who's had some pigmentation issues. She had to do a series of them. We did 3 on her, and it helps to lighten some of that pigmentation, along with some home care, which is product that we mix with a little bit of hydrocortisone, not hydrocortisone, hydroquinone, and some retin-A. Here's another patient. Shows some active acne and some pigmentation from the acne. That's a before and after. Here's another woman who has some acne as well, and it actually helps flatten or smooth out some of the acne scar. And here she goes. So you'll see it helps with the active acne, helps smooth out some of the scarring. Of course, the deep pitted ones, then we need to do other laser treatments to help that. Here you go. Here's a young man who has some pigmentation and some dehydration. If you look around his eyes, it's very dehydrated, his skin. So peels help with that dehydration. It helps with that pigment, and it helps to make the skin look just smoother and brighter and clearer. Here's another patient. So if you look at her lip, on her upper lip, that is melasma. It looks like almost looks like a stain that doesn't go away, as opposed to her nose where that's sun damage on the left side. So you can see the difference between the color of melasma and pigmentation from sun damage. Here's another patient with some acne. After A few peels. And here's another one. You see how this one also has some dehydration issues. You can see under her eyes how the skin is kind of taut, and she's got some pigmentation. Okay, here's another one. So overall, the skin, and it helps to lighten the skin. It helps with wrinkles. It helps with some pigmentation. She's a young girl who has some melasma as well. If you look at the size of her, by her eyebrow and her hairline to the top of her cheek, it looks like a coffee stain. That's indicative to a melasma. Here's another patient with some acne that we did 2 treatments on, and here's a VI peel after 2 treatments of the VI peel. It works very well for that. Yeah, tone and texture helps it. So it doesn't lighten your own natural skin color, but it'll help to lighten the pigment that's left behind, sun damage or acne. So we have many different types of peel. The VI Original, which is the one that I showed you, which is what we're going to do today. That's for all skin types. Then we have the VI Purify, which is the one for acne. And then the last one that we have is the VI Precision Peel, and that's really for pigment, melasma, and sun damage. There you go. So now, how are you gonna prep for a peel? So you're gonna do a double cleanse, which I wash my face, so don't have any makeup on right now. So you're gonna wash your face twice, just to make sure your skin is clean. Okay. I'm gonna put my hair in a ponytail, so that I can do the peel for you. So what you're going to do is you put your hair away from your face. You're gonna wash it twice. Okay, and then you're going to take your alcohol wipe, and you're going to make sure that there's nothing on your skin. So you're going to take your alcohol and wipe your skin down, and even though you just washed your face twice, sometimes there's a little dirt on there, and those are just surface oils. Okay, so we're going to do that again because there was still a little oil on my skin. So we're going to do that again until there's nothing left on your skin. That's perfect. There's nothing on. Okay. Now you're gonna take your little jar of Aquaphor. Okay. Put my glasses now. Right here, so I don't look like a total mess. So you're gonna take your Aquaphor, right? You're gonna take a little bit, all right, and you're gonna put it on your eyebrow. I'm looking at my camera. And the reason why we're putting that on there is because we don't want any of the peel to drip on your eye. Okay. So here we go, on the eyebrow, so nothing drips. You're also going to take a little of that Aquaphor. You're going to put it in the corners of your eye, on the outside, and then on the inside. Here. This is all for your protection so that you don't get any peel in your eye. And then you're going to do it right on the rim of the nose. And in the corners of the mouth. Okay? And then now you're ready for your peel. Simple, and there's still a lot of Aquaphor left. So you could use the Aquaphor, don't throw it away. When you're peeling, if you're really peeling a lot, then you can actually use the Aquaphor to help with that peel. So don't throw that away. And then in your kit, you're going to have a little cup where you're going to put your peel on. You're going to have a prep wipe, okay? You're going to have a gauze sponge, which is sterile. You're going to have your peel, okay? And that's what we're going to start with. There's some more things in here, but we're going to go over that after the peel, okay? So now you're going to take your cup and open up your peel. So it's a two-step to open this up. You take off the plastic, and then you're going to pull this ring out. There we go. You're going to pull the ring, pull it up and down. And while you do that, you're going to put your finger on the top of the top. And then you're going to pour it in your little cup. All right. At this point, you're going to get your gauze ready. Put it on the side. And you're going to open up your prep wipe. So, prep wipe, you're going to open it up.
You know, we can hardly see you because you're too small. Can you make your screen bigger?
Can you make the screen bigger?
We see the text, but not you. You're very small in the corner.
Okay.
Oh, yeah. Thank you very much. Thank you.
You look regular on my end.
Click on the
fine.
picture. Click on the picture and it shows you. You could expand it, make it bigger. If you click the picture, you'll see a thing. It says plus or minus.
Okay, so now you're going to take your wipe, the prep wipe, you're going to wipe your entire face with it. And what this does, it preps your skin for the actual peel. Okay? And you're going to do down to your neck. That's it. There's nothing on. This should be clean. You're going to put your glove on. Okay? And with your gauze pad, you're going to just hold it sort of like a little taco. Like a little taco. Okay? And you're just going to dip just the corner. And you're just going to put a tiny little bit on the gauze. All right? So you're going to start on your forehead from one side all the way across from your hairline to your temple, all the way across. Okay? And above your brows and down. Good. Now, with the same, without dipping again, you're going to go down the middle, down your nose, and down to the side of your face, under your eye, and all the way around up to your temple again. Okay? And now you're going to go down a little bit lower and go from the middle of your cheek and all the way across. You're just going to swipe in rows all the way along your face. So when you get to your nose or underneath your nose, you can do the top of your lip, across and all the way to the ear. Now you're going to do this all along the whole face until you cover the whole side of your face. Not dipping, you're still with that one dip, okay? You're going to do now the other side. I know it's going to feel like it's going to get dry, but that's okay. I'm going to show you why we're going to do that in a minute. All the way across until you get to the other side. And then when you get to here, you want to go one swipe down, all the way down to the bottom of your neck. Now your neck, you're only going to do twice, okay? Now we started on the forehead, so now what we're going to do, we're going to start on the right side of my face. So this is the second time you dip the corner, squeeze a little bit of it out. Now we're going to start here by the nose, underneath the eye, and around. So this is going to be the second pass. You're going to go all the way across down to the ear, all the way across down to the ear, and the chin all the way across, up, and all the way down. Good. Now the other side, we're going to start on this side and go all the way around, and just one pass on your whole face. Each time you dip, you're going to do one pass. Now the forehead. Good. So you're going to start to see my skin is going to be a little bit brown. A little bit brown. And what you're going to look for is you're going to look to see if you have any areas that we call frosted. Now, frosting is when the skin turns a little white or a little gray. And if that happens, that means your skin has absorbed enough and you can stop the peel, okay? But so that was 2 passes. Now we're going to do another one, okay? So we did this side and I did this side. Now I'm going to start with my left side, okay? So you're going to dip again, okay? So I'm going to start on this side here. So from the nose all the way to the other side. And you're going to cover your entire face in rows up until you do the entire side of your face. And then we're going to go across here and all the way to the other side. And then just keep on doing that until you get to the entire, until you cover your entire face. Okay? And then the last place we do is the forehead again. So that was the 3rd pass. I'm going to go over the nose to make sure we got the nose. Okay? And then the neck. Okay. Good. So we're just going to keep on doing the same thing over and over again until we either finish what we have in our jaw or we see what we call that frosting. At this point, if your face is going to feel a little warm, but if it feels really, really hot, then your skin has absorbed enough. So the first time I ever did a peel, I'm going to continue putting the peel on as I talk to you. The first time I ever did a peel, I'm going to start again with my forehead. I was only able to put 1 coat on my entire face. My face turned beet red and I was ready to call the fire department. It was on fire. But I peeled like crazy and my skin looked really good after that. So I was only able to do 1 coat my first time ever. So don't think that you're going to use this whole thing the first time you do it. Because you don't know how your skin is going to react, and we have to customize the peel for each person. Okay, so now I'm going to do my neck. Yeah, the first time I peeled, I think I peeled for like 2 weeks. After it was all peeled, I thought it was done, and it started peeling all over again. So now I'm going to do the areas of concern, okay? Because I did 4 layers. Now the areas that I have concern is my T-zone, because you get little blackheads. So you're dipping again. And now I'm going to make sure I get these little bumps that I get underneath my lip, my chin, my nose. So we get little blackheads there. And my area of concern is crow's feet. We don't want wrinkles around our eyes. So I'm going to go around. Do not go on your eyelid, but you're going to go around. Let me get closer. I'm going to show you from here, there, here, there. And that's it. You don't want to get any closer. The skin around our eyes is much thinner, so you don't need to do many coats of this. It will burn. It feels like it's hot right now, and that's normal. But you just have to look and make sure that you're not frosting. Okay? So we have some more left. I'm going to do another coat on my entire face. Okay, I'm going to start now with this side here. This side, whole side. And I'm going to go to the other side. So this can give you anywhere between 5 and 7 coats on the entire thing. So what I sometimes see people doing is they go on and then they rub onto the same spot over and over again. You don't want to do that. You want to apply 1 coat at a time, 1 row, come a little bit lower, and go a little bit lower, and just make sure you cover the entire face in 1 swoop. Okay? And that's it. So now I'm nice and red. I'm nice and red, and I look a little brown. And some people look darker than this. I guess it depends. It must be really white. From being quarantined indoors for a month. So I'm putting a little bit of on the neck And there you go. That's really it. I still have a tiny bit left, but I'm not going to put any more on because I have enough. Now what I'm going to show you is what we have in our packet. What we have in our packet now, this is our home care, all right? So let's say it's 3 o'clock now. So 7 o'clock tonight, I have a couple of things in here that I'm going to be using. I have some, post peel. Here we go. We have these 3 post peel wipes. So I'm supposed to put on one now, but I feel that it takes off my whole peel. So I never do it on a patient. I actually give it to the patient to use. And in 2 hours from now, I have them open up this wipe and wipe off on your entire face. And what's in here is some vitamin C and some retin-A, okay? And it'll just help give you a nice even peel. So in 2 hours, you can do one, and then at bedtime, you're gonna do the next one. So there comes 3. Okay, so 2 today, and then tomorrow, you're going to use your 3rd one. So it's used at nighttime. Okay, so you also have in your home care is some sunscreen. It's an SPF 50 that you're going to use every day, and you also have a post peel protectant, which has a little bit of hydrocortisone in there. So if you're red, if you're itching, you're going to put this on. It will help to soothe that. So you're going to use this underneath your sunscreen during the day, and you're going to use it at nighttime. And while you're peeling, you're going to take it with you. And as you're peeling, if you're itchy during the day, it's just going to help with some of that peel. I was in a class once, and it was day 4, I think. I woke up, I had a little bit on my mouth. I was like, I was fine. Throughout the class, my skin kept on getting drier and drier. When we break for lunch, when I went to the bathroom, my skin was all like peeling and shedding. So this would have been perfect to have with me at that moment. Some tips: you don't want to peel the skin. So once it starts to peel, you don't want to rip that skin off. You want it to naturally fall off. You can put the moisturizer on, rub it in, and let it do its thing without pulling it. Especially if you're darker skin type, 4, 5, and 6. If you're pulling it, you have a higher chance of getting PIH, which is post-inflammatory pigmentation. So because you're causing some trauma to the skin, if you're pulling it, you can cause a little brown spot. So you want to prevent that. Okay. So again, we have 2 cleansers in our take home. We have our post-peel protectant. We have our sunscreen. And then we have our 3 post-peel towelettes. So at nighttime, so today I'm going to use these 2. And then tomorrow night, after I wash my face, I'm going to use 3. Okay? And then that's it. Let me go over this. So does anybody have any questions? Okay. Does anybody have any questions?
So if you have any questions, hey guys, it's Jocelyn. I'm here with Louisa. If you guys have any questions, feel free to write them in the chat. But Louisa will be doing virtual consults moving forward, complimentary skincare. So if you want to speak with her about your skincare concerns, just send us an email, go to our website. And if we're also going to be offering anyone who joined this webinar 20% off our virtual VI peels. So exactly what Louisa did today, she'll send it to you and you'll receive 20% off of the peels. So let's see if you have any questions here. So someone has said that they have PIH on their lips. What should they do?
PIH on the lips. So if it's PIH, if it's PIH and not melasma, we can mix you a compound that'll help to lighten it. The peel will also help to lighten it as well. So you have the two options. You can do a peel, or we can mix you something to use. And I would probably use a pad that I put some retin-A in and a little hydroquinone to help break up some of that PIH. So PIH would usually resolve with the use of the product, and as long as it is just PIH, it'll go away on it. It'll go away with that, and then you don't have to worry about it. If it's melasma, then you have to be on a maintenance, because melasma never goes away, and you always have to do something to help control the melasma.
Let's see what's the next question.
She's reading them to me because I have no glasses on.
So microneedling with RD or Pro for African American skin?
Microneedling I do like a lot because it doesn't create a lot of heat, and there's a very low chance of post-inflammatory pigmentation because of that. So microneedling is a great option for African American skin.
So RF or PRP? Can you explain those two?
So RF is radio frequency, and they two different things. So RF is a radio frequency, usually done with like little tiny needles that goes into the skin, and little needles come out, and those little needles bring some radio frequency down to deeper layers of skin. And what it does, it helps to stimulate some skin tightening. Whereas PRP is we take your own blood and we put it through the centrifuge, and we can either use microneedling to topically apply that, or we can inject it under your skin. So they do two different things. One is for skin health, which is the PRP, and the other one helps tighten skin. So they're completely two different. Can you use them together? Yes, you can. You can do them together, absolutely. But they both do different things.
Okay, I think we have a couple more. Can I peel my lips?
Can you peel your lips? You can peel your lips, but not with the VI peel. We have something called a Glytone lip and eye peel. The skin on our lips is really sensitive, so you have to be really careful. So with the Glytone peel that we have, we can go on the lip itself and on the eye itself. That we can't send to you because your eyes are closed and you can't see what you're doing when we do the lip and eye peel. And with that peel, you don't necessarily peel like you will with this. Your skin won't slough off, but it will slough off on a micro level. So it'll make your lips smoother and softer, and it'll help improve the texture, and it'll help increase the hydration.
Can we do the VI Precision at home?
Yes, you could. So with all the peels that we can ship you, each one of them we have to go over. We're gonna do it together. So on your home, we're gonna Zoom or FaceTime, and we'll have to do it together, each step. And so there's a couple of other steps included at the end of the VI peel, the precision peel that you take home. So instead of 3 wipes, you're gonna have 6 wipes, and they one is like for the pigment, and then the other one is to help with vitamin C, some lightening. So it's just an extra step, but yes, you can do the precision peel at home. We do it together.
Next, should I store my cosmetics in the refrigerator? Question?
So, yeah, some cosmetics, are you talking about, if you're talking about lipsticks and stuff, yeah, if it's going to be in there for a long time, yeah. But if you're talking about certain creams, we have certain things that we mix for you, specially mix for you, which there's no preservatives in there. So we do like to keep it in a cool place. It doesn't have to be the refrigerator, but in a cool, dry place would be better than someplace that's hot and steamy. So I have my products. I don't really, because I take really hot showers and something really wrong with me. The water's dripping on the ceiling when I'm done. So I don't like to keep my products in my bathroom. I actually have a closet outside of my bathroom, which is like a linen closet where I keep all my products, and that's fine. Just not in a warm place. So cool and dry.
Okay. Next question. I have sun damage on my face, neck, chest, and arms and hands. Is it best to use the peel for the face and something else for the larger areas?
So we like to do a peel on just a small area at a time, 30% of the body at a time. So can you do a peel on the arms and the hands? Yes, but I would separate it. I would either do the décolleté or the face one time, and a couple of weeks later, I can do another area. So the VI peel is one of the few peels that you can actually do on the body as well. And the VI peel can actually be done on the décolleté. That being said, some of the pigmentation that people get on the hands and the arms are a little bit difficult because if you look at the pigment, sometimes if you stretch out the skin, it looks like there's a covering over it. It looks like there's a thin film of plastic on it. So that's a different type of lesion. So sometimes you need a laser to break some of that up. So it really depends. And I would have to take a look at it before I can tell you whether it could help that or not.
Okay. I think we can answer maybe one more question just because we're running out of time. So let's see. What is the best skincare method to help with acne scarring on African American skin with serious pigmentation?
Yeah, I would do the VI Purify Precision, which is another peel that we have in the line. So it's a precision peel, but the solution is the Purify. So it helps with the acne and it'll help with the pigment. That and also home care. I'd like to go over like home care with you and see what you're using at home. One, to help prevent some of that acne and to keep it under control. And also to see if maybe some of the products that you're using is causing that acne. Because a lot of times that acne cosmetic is from some of the foundation that you may be using or some of the products that you may be using. So we would go over what you're using. We'll look at the ingredients and seeing if maybe that's what your problem, maybe that's where the problem stems from. So it's a little bit of a challenge, and so it's not just okay, a peel will fix everything, but we have to figure out why do you have the acne to begin with. Is it hormonal? Is it from cosmetics? Is it from something that you're using, or it could be something that you're eating? So that would be something that we can also discuss, and we can also discuss it over the phone in private if you like.
Okay, I think that's it. Thank you so much. Most of you want to see you in here. So Luisa will be offering complimentary virtual consultations, like we said. And if you want, you can head to our website. There's a virtual consultation form that you fill out. And she can speak to you about your skincare, speak to you about your home care, whatever issues or concerns you have. And then, like we said, we're offering these at-home VI peel kits, which are amazing. I don't think anyone else is doing this. So definitely now's the time to get your hands on it. You're probably not going outside anywhere, so you probably have a lot of that extra downtime. So it's really the perfect time to be using a peel. And again, we're offering 20% off if you mention that you're on this webinar. So I think it's a really good deal. And, we hope to see you next time for Dr. Tehrani's next webinar next Wednesday. Thanks, guys.
Thank you. Bye, everybody.